Good afternoon, everyone. My name is Angela Castellanos, and I'm the school mental health specialist for the Pacific Southwest Mental Health Transfer Technical Center. And we welcome everybody here today for part two of the series, Trauma Informed Suicide Prevention, Leading School Leaders, County and Statewide Systems, What Every Leader Wants to Know. And also wanted to remind you, do a couple of different housekeeping items here. If you have questions during the session, please post them in the questions chat box. And a copy of today's presentation and handouts also can be downloaded from the pod located below the list of attendees as well. And also, if you have any comments, please post them in the chat box as well. The session will be recorded and it will be available 7 to 10 days after the presentation today. And again, welcome to What Every Leader Wants to Know. This is a no-cost 3-part webinar series. Welcome to those that actually were here last week at part 1. Part 2, today we're going to talk about what every school leader wants to know. And this is part 2. And next week we'll have part 3 of the series. You know, one of the things that we wanted to start off with is that there's a lot of support out there, and these national organizations are there available to support anyone that needs any type of resources, mental health resources, or is at risk for suicide. All of these resources are available 24/7, and this is going to be available to you at your slides as well. This presentation was prepared for the Pacific Southwest MHTTC under a cooperative agreement from the Substance Abuse and Mental Health Services Administration. The rest of the presentation is basically information for you here, and you can get that information on the slides. This is the wonderful map that illustrates the 10 technical centers nationwide. And the Pacific Southwest is part of the Region 9 of the Mental Health Transfer Center. Our role is to provide training and technical assistance and resource dissemination to support mental health workforce, and also to really provide evidence-based, culturally appropriate mental health prevention, treatment, and recovery strategies for providers and practitioners so that they can strengthen and sustain them effectively. These are some of the services available: no-cost training, technical assistance, and resources. The MHTTC network uses affirming, respectful, and recovery-oriented language in all activities. As we're thinking about today's presentation, suicide prevention, what every school leader wants to know, we're thinking about suicide and also connecting all of these different affirming, respectful, and recovery-oriented language. As you're looking at this particular slide, we want you to think about some of the quotes or statements that resonate for you. So I want you to take a couple of seconds just to kind of look at the slide, and you can actually write that information in the chat. What resonates for you as you're thinking about today's journey in suicide prevention? So Olivia will be talking about the upcoming webinar series. So these are some of the upcoming distance learning opportunities. And so part 3 will be next week, next Monday. We're going to talk about setting the stage, collaboration, and risk assessment. One of the pieces that we want you to think about is, as your district leaders, we're not going to focus specifically on how to conduct a risk assessment. We know that there's a lot of different trainings available. What we're going to really focus specifically on is how to really integrate and collaborate with providers, and also creating a really thorough trauma-informed risk assessment process for school districts. And as you're looking at some of the different upcoming distance learning opportunities, you can check them out. And this is going to also be available as part of your the slide deck. So if you're interested in any of these opportunities, feel free to actually check out some of the different flyers available here. Here are some additional upcoming distance learning opportunities. And also, if you missed a previous webinar, for example, if you missed part 1, these webinars are recorded, and you can actually access all of the recordings through this particular link available for you. You will receive a certificate of completion, and it's going to be automatically received or emailed to the participants. And also, if you have any questions about certificates of completion, please email Joanne at this email to report your participation. You're also going to be receiving continuing education hours available, and you're also going to be receiving an email on how to access this information once this webinar terminates or finishes. So now that we have gotten that out of the way, as part of the webinar series, we have Heidi Cisneros and Tina Rocha and myself. Hi. We're actually combined together. We have about 60 years of experience. I know it's very hard to believe because we're all very young. But we've all actually provided suicide prevention and school mental health implementation in a variety of different school districts. We all have been district leaders. We all have actually social work degrees and have provided site-based strategies in suicide prevention policies implementation, as well as school mental health resources. So you're in good hands today. You can trust me on that one. Today's presentation, we're going to talk about, for those that didn't participate last week, we're going to do a very short review in regards to trauma-informed practices as it relates to suicide prevention. We're going to do a little bit of review as well as the suicide prevention model policies. And we want you to keep in mind that the strategies that we're going to be discussing today apply to California Assembly Bill 2246. We're also going to be talking to you about suicide prevention tiered activities and also talk about some of the strategies. And also we have it in quotes there, strategies. So we're going to talk about strategies, but also tragedies that in relation to our learning experience or learning lessons that we've actually encountered as district leaders in implementing suicide prevention policies. We're also going to talk about branding and effective outreach activities and how to really promote and create these activities to promote suicide prevention. And also keeping in mind, as you're implementing all these suicide prevention interventions, is really to make sure that you're incorporating the cultural competency, equity related issues, and also making sure that you're servicing the vulnerable populations as it relates to Assembly Bill 2246, which is this model suicide prevention policy for California. Throughout our series, our objectives are really to talk about help and coach school leaders to implement a trauma-informed suicide prevention policy, resources available to schools. We're going to be providing you with actual tangible information and resources that you can take back to your school districts to really conduct effective resources, risk assessments, and as well as creating a really thorough intervention prevention process. And really the other last piece too is how to really connect and collaborate with all of the school staff, but also with providers in the community and parents. Everyone's really part of that continuum of support for students and how to really have that conversation and have that buy-in with additional providers and creating that the process for community building.
So again, we want to welcome everybody here from across the country and even locally. We know that talking about suicide, even in the prevention of it, can be a lot. And so we want to make sure that we are present, we're grounded, and we wanted to just share this quote with you. Many of you are familiar with Brené Brown. We are big fans. And she talks a lot about vulnerability, and she talks a lot about the tough stuff. And today definitely qualifies for some of the tough stuff. And so we wanted to just ground ourselves with this quote that says, we've got to feel what we are feeling, but we've also got to move forward and through it. I have my ideas of what that means. I want to give just a moment before we get started here and all of the slides and the information. But as you read this quote, please feel free in the comments chat box. Let us know what this means to you. Please take a moment, if you'd like, to share in the chat box what you think this quote means to you in the context of suicide prevention. You can't heal what you can't feel. Thank you, Anna. And don't let yourself get stuck in the grief. Absolutely. Exchange the but for an and, right? And. I like this. I like this a lot. I think what we're getting at is that we are human, and there's a humanity piece to this that cannot get lost in all of the slides. That at the heart of it, we come into each situation, prevention or response to suicide with ourselves. We ask you to acknowledge where you're at. We ask you to acknowledge your comfort level. And what we hope to do today is to add to your toolbox and allow us to be in that preventative space so we can prepare to be to help, our students, our staff, our families move through the pain, move through the impact of suicide. So we thank you again for being present. We thank you for being with us in this journey. We'll be checking that chat throughout the time together, and you will also have our contact information at the end of this as well to continue the discussions or to reach out for any additional help. So before I switch to the next slide, I want to highlight a couple more reflections. That reflecting and acknowledging where we're at with the intention to move through it, acknowledgement of the feelings and find ways to not getting just stuck in the feeling, but move towards healing. Absolutely. So we invite you again to stay with us, and let's move towards healing. On the next slide, we just want to remind you to take care of yourself today. That, again, even in the discussion of prevention of suicide, that you may need support or you may need to step back or away from some of the content. And absolutely, do what you need to do to take care of yourself. And remember, too, we are a community on this chat. Reach out to us if you need to. And if you haven't already, in the spirit of community, please continue to put in your information in the comments chat. We want to know where you're from, what role you play, and just keep this dialogue going, even if it's over text or over the chat box. Again, this is the second session that we are jumping into, and we welcome back folks who joined us for the first session. I'd love to see if there are, for those of you who are returning to us, what are your first session takeaways? If you could, in the comments chat box, that's the top one there, please type in takeaways you remember from session 1. So we'll take a moment and pause, and please put in what takeaways you got from session 1, which was in general about policy. We all feel that way. Our districts have a lot to do. There's a lot more work, and the world is changing, and COVID has not made it any easier. So I think we're all in a similar boat with that one. Make sure your policies are updated. Absolutely. It's a marathon, not a sprint. This is wonderful. Hi, Karen. And we want to broaden the coalition. So absolutely ensure that we have collaboratives, right? Make sure that we're not doing this alone, right? That we are a village in the support of our students, staff, and families. And I want to invite, I was going to say, do you want to share some takeaways yourselves, presenters, from the last one? Yeah.
A takeaway? Oh, yeah. So one of the takeaways, I think, is kind of reminded me of one of the comments is that the work is it's never ending. There's always an evolution to the work that we do. And then as district leaders, it's really important that we also take care of ourselves, because this work is very heavy. So those are some of the takeaways that, I took off from last week.
I just want to remind everyone, first of all, it's very exciting to see so many social workers and behavioral health folks working in collaboration with schools, and even better, being school-based. I mean, that's something that's a new phenomenon in just the last 5 to 10 years. So that's very exciting in itself. And remember that even though you may be in a direct service type of position, you are still a school leader. And when we refer to that term throughout our work, we are referring to you. You are the leader, the person, the go-to when it comes to mental health issues and all the things that we're talking about today. So I just want to remind everyone, we're talking about you. You are our school leaders.
Thank you both. And I was just going to say that in the chat, folks, if you're still putting in some reflections from session one, please do so. What you share is helpful to others who maybe were not able to join us. One that's on the screen is it takes a well thought out intentional plan, and it takes a team and collaboration. And yes, even in this work, not only are we bringing awareness, but we're trying to get buy-in. So thank you for that reflection. I really appreciate that. Is that Rosalind? And so with that, we begin with the presentation. So we'll move forward. Thank you.
Thank you, Tina. So we're going to do a little bit of review, like I mentioned earlier. And so for those that actually participated in the part one, I'm going to repeat a little bit of information, so bear with us. But one of the things that we talked about as a team when we were creating this particular presentation is we thought about like what would be such a great opportunity for the takeaway for individuals as they're participating in this webinar. I don't know about you, but every time that I've attended a webinar, I take a lot of copious notes, right? But I also kind of go back to some of the things, and then I go back to my district and I forget, right? So this particular implementation tool, it's really designed to think about ideas. So as things come up for you throughout the entire webinar today, we want you to think about some ideas. What are some things that are going well for your district, and what are some things that you can actually enhance as part of the resources? Because it's really about sharing best practices, sharing resources. And then also throughout the entire webinar today, we're going to take a couple of pauses and do a little bit of reflection depending on how much time we have available. But we're going to walk you through this process. We're going to take you through a journey that Heidi, Tina, and I have created through this entire process of creating suicide prevention policies in a variety of school districts here in California. And hopefully you guys are able to download this particular tool. If not, we're going to put it in the chat in a second, and we can go from there. And so as we were thinking about creating this kind of review, this part two series, we're thinking about what are some of the pieces that are really important to highlight as school leaders in the creation of suicide prevention policies and activities. And so as we're thinking about trauma, part of the review is that we know what trauma is based on all the different experiences that are here today. We have so many great mental health experts, and we know what trauma is. We know that there's an impact of an event that happens to a particular individual. It could be an individual, a group, or a community, and we know that it has some kind of harmful impact on that individual. As we're thinking about trauma informed, we are very much aware. We have a lens, we have glasses, earphones, whatever you want to, the metaphor you want to use. But we're really cognizant about the way that the impact of this trauma has affected either the individual, the community. What are these survivors what are they experiencing as well? A trauma-informed program, organization, or system really works to decrease the re-traumatization of those individuals or that community, and really working in increasing that resiliency, increasing the healing and the well-being for those that are impacted. And they're constantly seeking to support those individuals to make sure that they're recovering through that traumatic experience. The other piece that we talked about last week is really important to ensure that everybody's talking the same language, right? When suicide prevention policy implementation and protocols, we want to make sure that everybody's using the right information, the right language. Part of the conversation is that you're creating this environment, this trauma-informed environment for those individuals that are at risk for suicide. You're inviting them to have a conversation with you. You're creating them. When they come into your room, into your office, they feel comfortable in having a conversation with you. Part of our responsibility as school leaders, our duty is to make sure that the kids and even our staffs or colleagues are safe from harm, and also providing the resources that they need in order to be able to move forward with their crisis, with their traumatic experience. But it's really about creating that terminology that's really important to create that the environment to feel supported. And as we're talking about this trauma experience, Heidi's going to review the journey that we went through last week.
Well, yes, welcome. I'm so excited because I see throughout the comments, lots of you remembered some of those important points that we emphasized, which was this is not a one-person show. This is a team approach. We want to protect you from burning out and taking too much on. And so I'm just going to review real quick. Not only is it not a one-person show, but it's more of a several-year plan. The first year, is really building that foundation, finalizing that board policy, ensuring that protocols are developed, those core pieces. And then year 2, you start getting into who needs specialized training besides the actual hands-on assessment folks, but like who are outside those groups that need training, our classified groups, administrators, where are our vulnerable students. And then that year 3, where you really get to be creative, and that's part of what today is about. We're going to be sharing lots of year 2 and 3 activities just to give you ideas and inspirations to take with you wherever you are. These are just ideas that we know that have worked for us. And of course, you're welcome to take them and put your own twist. And hopefully they inspire even additional ideas. But the goal here is to develop trauma-informed activities and services to get the message out in your campaign. Because again, remember we talked about our iGen students, our Gen Z students, which I know we have some folks from colleges here and universities that goes up to through your sophomore year, who are known as the most disconnected connected, or some say the most connected disconnected, depending what you read. But the bottom line here is how do we reach out and let them know that they need to connect and that we want to connect with them when they are indeed struggling. And that's what this plan is about, getting that message out, developing a campaign. But remember, campaigns that are just about slogans are superficial and basic. Those are not what we would consider an intervention or something that is truly going to change the climate or how people approach sensitive things such as suicide prevention. But when a campaign also has the training behind it, the board policies behind it, and staff stepping up to work together, that's when you have true district climate change and a new, healthier, supportive environment. So here on this slide, you can see we've outlined some of the items to focus on each year. And again, here's year 1, just focusing on board policy, your video, your basic items. These are, again, things I've talked about. So really defining your priorities each year once you have established the foundation. So for us, again, it was critical to develop a message that we could use in our trainings, in our parent meetings, in our media to the community that would share that message of we want you to get help. And again, our slogan became we care, get help. And it was essential to be positive. It was essential to be affirmative and hopeful because, again, those are the qualities that our Gen Z students most resonate with. So we hope you'll see those traits as we share our video with you. Although it is what we would consider a positive, affirming video, there are some tearful moments, and hopefully you notice the song where we have our student honor choir singing, which we got a special license from Sony Records. You may recall the song, but it was perfect touch to making this video authentic and a tool to connect with our students. So please enjoy. Can folks hear it?
If you're trying to play the video, just so you know, please click on the red button or the link is immediately underneath that. Each video plays individually on your computer. So if you're not able to view it, please try the link. Also, Joanne has just put the link in the comments box. So there is a new link. Please try that. We're hoping that works. Thank you, Joanne. So we're going to give folks about another minute or so to finish off the video. Okay, so it sounds like everybody's done with the video. Okay, one of the reflective questions that we want you to do is if you're thinking about, as you're watching the video, what stood out to you? You're ready to go.
We have a quick question. The age range was elementary through high school. You saw some of the photos featuring some elementary activities, some younger student representatives, and then, of course, it went through high school.
Mm-hmm. Yeah, the district-wide collaboration really stood out. That's one of the things that I really highlighted for me as well, that everybody was part of this process, right? So it's, everybody's involved in the continuum of support for students. Community connections.
Yeah, and while we had, some talented folks who helped direct us a bit here and there, it really was directed as far as content by students who suggested different things. And so that's why we had our choir, and we had students featured from all our different schools who were from different programs. And you may have noticed school boards, school nurses, school psychs, social workers, folks who are here on this webinar today were featured in it, Alva. And so the idea was to show the community, show our students that everyone's on board. And again, a video by itself is not strong enough to create change in a culture, especially an institution like a school district. But when a video is then followed up with the other pieces, which are the campaign items that we're going to show today, you'll see that that's the winning formula for effective change. That's the magic sauce. And so within days and weeks of the video initially being released, staff were wearing our We Care fashion items, as I like to call them, our swag. Posters and artwork were everywhere, and training started. And so, again, the message was out, but then it was supported by that meaningful content. And I just want a helpful reminder, as you move forward to do videos and other type of media messages, do your best not to make them dated so that they are useful and helpful and relevant for years to come, because they do take a lot of effort, as I know many of you know. And so this video is about 3.5 years old. And while some personnel have changed in the video, other than that, it is still relevant. It still connects with students today. And so we're really excited about that because, as I mentioned, there's a lot of work that goes into it.
It does. I have a question, Heidi. How long did it take for this video to be created?
Well, we had an amazing director who was very community-based, a social worker who had some media background, and she had a drone as well, and so that's where you see the drone flying over the students. Other than that, she just went to several community student activities, interviewed students, and she was able to put it together in just a few weeks. The hardest part was getting the license for the song, which the song isn't necessary. It was a nice touch because at that time it was a top 10 hit, and it was about suicide. So many of you probably remember it. The title of the song was actually the hotline number. So we felt it was a great option, so it was worth waiting for the license. But other than that, honestly, we were able to put it together in 2 to 3 weeks.
Yeah, and one of the things that I kind of think about is getting creative. So this could be, for those that are in school districts and have PPSC interns, this could be such a great macro project for them. And that's free service, right? You don't need to get extra funding. So that's such a great opportunity for interns to be part of this conversation as well.
Absolutely.
And that kind of actually goes into Catherine's question about, Heidi, was there a grant or what kind of funding, I guess, to help implement this program? Can you talk a little bit, or specifically the video?
So in California, we're fortunate to have LCAP funding. So we were able to get a few thousand, a couple thousand, if you will, dollars to support the director in putting this together. Of course, typically she would have charged much more. She gave us a great deal because, as I mentioned last week, you want to diversify your task force because you want to bring diverse talents to your team. And this was her talent, and she was one of the co-founders and co-directors of the task force. So, of course, she just charged us for supplies and materials and basics and the folks that helped her, but she ended up donating her time. So lots of media companies are out there that want to get a good start. So you can partner with them and say, hey, we're going to put you in front of 50,000 of our students and get you free advertising. Can you do a video for us? So lots of ways of getting these type of things produced. And I think what Angela said is so on point. Lots of interns and other folks are excited about doing these kind of things. And there are a lot more tools nowadays as well.
Yeah, or even partnering up with some. We're going to talk about collaboration later on, but this is something that some of your providers can also support with as well. So thank you for all that information. I think one of the pieces, as I mentioned, with the implementation planning tool, as you're thinking about messaging, going back to the implementation tool, the question is, for reflection, how can media assist with promoting your message? All right, so we're going to reflect on that for about a minute. And then write your responses on the implementation planning tool, or you can actually share some of those comments in the chat box. And then also the last piece is on the ICT, write at least one action item in this area that you or your team are going to follow up with within the next week or so in regards to messaging. I'm going to give you an example. In one of the previous school districts that I worked for, one of the high schools had a strong media influence. And so the students were actually, the high school involved the students in doing the morning announcements they had their own channel. So using those things that are already available, resources that are available as well. Those are really great opportunities for you to utilize some of those resources also. Hey, there's a question on there about, action item. Catherine, she talked about developing a team to work on suicide prevention awareness. But there is a question about parental consent for each minor in the video. It's really important to make sure that we use
Yes. Perfect timing. I was just typing it out. So yes, consent is needed when you're featuring students. Group shots, not necessarily. In our district, and I think most districts, students typically fill out a consent form during enrollment that says the parents release them for any type of district activities, interviews, activities, or any online sharing of anything that they're involved in that relates to the district. And so we didn't have to get a special consent for this video because it was under the umbrella of the district. So because the students had filled out permission to be a part of any kind of media with the district, we didn't need a special permission.
Yeah. And then just to kind of recap a couple of things about funding, Heidi, you mentioned LCAP, and I know there's other individuals from other states here. And so LCAP stands for Local Control Funding Formula, which is allocations and appointments through funding through the California Department of Education. So just wanted to make sure that we gave some folks that don't live in California that information. All right, we're going to move on. I know that there's so much great information that's going to happen next. So we'll talk a little bit about activities.
So we want to share some of the details of the activities that have been provided to promote the message for suicide prevention. And we'll kind of go back and forth between the larger, maybe nationwide or state or county-wide initiatives. But we will also look at what are we providing in more of the micro environment, right? So this particular slide talks a little bit more, as I mentioned, about the campaigns or initiatives that are happening in and around us. Many of you are familiar with that logo right there. They know the signs. It's more of a national suicide prevention campaign, whereas the other ones that are kind of more in the green are our California state campaigns, all geared to promoting the message of get help and prevent suicide. Each Mind Matters is one that does support, again, state and county. Directing change is it's much more specific. It actually is a contest where students can actually submit their videos, much like a PSA, right, to send their message to prevent suicide and to encourage help-seeking behaviors. In the middle here to the left, you see a little poster of Awareness Week, and you'll notice that the date is somewhere in the middle of March. And while that's not necessarily aligned with, for example, Mental Health Awareness Month or Suicide Prevention Month, many times we had school sites wanting to ensure that they have a week or a month dedicated to the campaign because they wanted to make sure they didn't miss students. And as May falls toward the end of the school year, they push theirs up to March to ensure, like I said, that we don't miss anybody. So know that though we talk about alignment with these campaigns, many times they're a good source of resources and materials. And we don't have, when I say aligned with their goals, it doesn't always have to be aligned just with their time frame. But we want to give you an idea of what we were looking at in our calendar and what we wanted to align with in our district. The last logo there, Promise to Talk, is actually a community-wide sponsored campaign, and actually Providence is actually a network of hospitals within our region. And this is actually, when I say it's community-based, I will say that this is for not just students, but it's youth and adults. And it's funded by a local group of hospitals or that particular network. But we absolutely do work with them to bring the message to our school site. So know that even if it's not a school-based initiative, that there are partners and they want to be able to partner with you to share that message. And for those of us who are worried about where are we going to get the funding for those green ribbons, or where are we going to get the funding for the for the bracelets. If it's not provided through your county resources, there's also more available through private foundation and other campaigns that are going on there. So looking at the slide, or back to the slide, really what we wanted to highlight is there are two particular times of year that we really allowed that campaign to shine or to be highlighted. Suicide Prevention Month is typically in September, and you're going to also see that there is Suicide Prevention Week also in the same month. The second piece of the campaign is Mental Health Awareness Month, and you'll notice just by virtue of the calendar, it's at the beginning and the end of the school year. And so there's so much to do within that school year. We want to share that with you, but again, start off and end that year strong with the push for mental health awareness and suicide prevention. As we go forward, there are other things that happen. Everybody has a parent and student handbook that is handed out, and whether that means putting that campaign on that front cover to make sure folks know and it becomes second nature to them to be able to say your campaign. In our case, it was We Care. Or if it's putting the resources on the first page to say that there is help here when you need it, use that resource. That goes to every single family, or at least required to go to every single family and student. As you all know, one of the requirements per legislation was to have the National Suicide Hotline on all ID cards. And so there is typically a distributor that you work with within your region. Ours was Johnston's, but absolutely ensure that that's available. And that was one of the, again, per legislation, that was actually named as something that needs to be done. So ensure that you do that. Adoption and training of standardized assessments for professional teams. Now, what was really interesting, and this is, there are quite a few disciplines within our schools and school districts. And what we found, of course, is that everybody has a particular assessment tool that they would like to use. What we ask for is standardization among that team. So school psychologists, for example, absolutely use the Columbia Suicide Severity Rating Scale assessment tool, right? Whereas the school social work team developed their own tool in which to provide assessment. Either way, standardize within that particular discipline, ensure that that is known by the other professional teams so that there is understanding as well as respect, right, of each and every assessment and what's being done by each team. So that's just what we worked on within our district. The next slide, I wanted to actually provide for you a planning tool, right? And so the next slide talks about months and themes. And this is just a sampling of what's available throughout the year. I hate to say, but we almost have no excuse not to be talking about mental health awareness and getting help now, because there is something happening every month. From the beginning of the school year, I talked about September, August, the National Night Out, for example, the National Safety Night that includes law enforcement, first responders, and so what a perfect opportunity. It happens within the community, but why not bring the community in to talk about or to get resources for suicide awareness? You'll see through some of the other dates, and I don't want to speed through them, but October is actually, there's a lot going on. Mental Illness Awareness Week, Emotional Wellness Month, right? And so while illness may be different from health, we still want to provide education. We still want to provide resources. You'll see efforts for World Kindness Day that are typically tied to bullying, or World Children's Day. All of these things, even a sense of gratitude in November, all of those things can be incorporated. And Day of the Dead, you'll see some pictures of the Noche de Altares a little bit later on, where you'll actually see the bridging of both culture as well as the suicide prevention campaign in real time within the community. So we want to make sure that you have that. And also keep in mind that wherever you are throughout the country, embedding those cultural pieces are going to be critical to ensuring that we have the support not only of the community but of our families too. So We continue on, of course, the holidays. January is right around the corner, so if you're thinking about goal setting and visioning, please use that. In another group that we've been meeting with, there was a great talk about visioning and vision boards and using gritx.org to be able to create a vision board, all things that support the message. We decided as a district in February to actually create a suicide prevention campaign day, and it was a day to actually align all school sites, the community, everybody, to do something related to suicide prevention and We Care. And it was a day dedicated, and for us it was the first Friday of February, and it continues as we speak. But it was a day not only to acknowledge the helpers around us, those who work in the mission of suicide prevention and acknowledging them. It was also a day to showcase things like our art contest winners. An art contest that was, of course, dedicated to getting help now in regards to accessing mental health support. For others, that is a month of random acts of kindness. The next month, we have professional month. And so many of you are aware of National Social Worker Month. What a great opportunity for us to be leaders, for social workers to be leaders in the message of suicide prevention. And again, the list goes on. And so I guess what I just wanted to say is, again, look for a reason. It's easy and it's out there. But there's so many ways, again, to find a reason to show that we care and that there is help.
And Tina, I wanted to throw out also that this is a great map for planning because you can coordinate activities throughout the month. But also, if you're not quite ready to kick off a major district-wide campaign focusing on suicide prevention, do some pilots. Choose one of these months like Tina suggested and do some activities just to see like what kind of response you get, which schools are stepping up, and use them as, if you will, an experiment so that you can do even more effective planning for the next school year. It's always a good thing to do pilots. Pilots is one of my favorite words because it prepares you in so many ways.
It sure is. And the other thing I was going to say, just to add on to this, is when you see a professional day like National School Nurses Day, for example, in the month of May, in this interdisciplinary team, right, that's a perfect day or perfect month to put, for example, or to ask the school nurses to take lead and do something for that particular month. So it's not only alignment with the theme, but it's also assignment or asking folks to kind of step in and take over for one particular initiative for the campaign. We will talk now a little bit about how we tiered some of the activities. We're going to focus more specifically on the mental health services that are being provided, but we want you to see what can support, again, suicide prevention. And so I'm hoping that everybody here, and I'm guessing that we are all familiar with the tiers. And of course, we'll start out actually with Tier 3, the most intensive, right, where we are providing individual and group support for our students with greatest need. And so what I want you to also kind of pick up on some of these charts is there's a new plan. That when we started out, we were kind of more on the right column here about being in person, right? And now my hope is that in planning your direct services as well as your campaigns, that you are looking at how do we do this in distance learning, because it is still possible. You'll see that the major changes in the during distance learning piece is really that we've gone telehealth-based. We've become, I'd like to say masters, but I feel like I'm jinxing us, but masters in Zoom, WebEx, or whatever system that you happen to be using. Maybe it's Adobe Connect, and you're really good at this, whereas it's new for us. But becoming knowledgeable about that has been what we've been working on, and so you can have that campaign piece. You can have prevention services. You can see the list there of what mental health services have been provided, from individual family counseling to the assessment to even re-entry support services, which we are going to talk more about and give you the tools for in session 3. But it goes on with crisis intervention, and even in distance learning, there is the component of dropping out those basic needs for resource delivery. In person, we're used to this. We're very used to these kinds of services. We urge that folks continue to provide that in support of, again, mental health services. The next slide talks a little bit about a specific intervention that was a brainchild of Heidi.
Well, thank you, Tia, for giving me so much credit, but truly it was about the staff who came up with this. And what we realized, and I know many of you experience, is whether you're in an agency or a school district, you're always shorthanded. And then we have those students and clients that are in frequent need of services and ideation assessments and risk assessments, and there just never seems to be enough of us to go around. And so we tried to strategize interventions, like what can we do with these students so that we're monitoring them, yet we can't and don't have the personnel to be with them every day or 3 times a week for ideation assessments. So one of the things that caught our attention is research on rumination. And as long as students who are frequent attempters or have consistent anxiety and sadness and are really focused on that part in their life, are together as friends, which is what we discovered, we knew that they would not grow into a healthier, more stable place. But instead what we did is we did keep them together, but we brought in a mental health staff member, a school psych at one school and a school social worker at another. And we assigned them to be essentially We Care ambassadors. So given that their peers throughout their schools knew that they had experienced some anxiety around suicide, maybe they had even attempted, it depends, everyone was different, they became ambassadors in this We Care club. And so this mental health person would facilitate discussions on how they, as an ambassador, could support their peers and encouraging them to get help and encouraging people to be positive to each other. And so by fulfilling this new role, they started to feel a lot more self-confidence, a lot more hopeful about life. And so their symptoms were also mitigated. And so what we realized, it was actually an intervention. And so we began to design these clubs wherever we would have small groups of students who we knew were connected, who we knew were ruminators, and students who were in frequent need. And so the key here is to have the right person in charge. You need to have a mental health person because essentially they still need that monitoring. But once they get really excited about this, they start doing so many wonderful things for the campaign at their school. And then, of course, we gave them shirts so that they were official. You got to have T-shirts to be official. And then, in our 3 pilot projects, we were able to essentially reduce the ideation assessments by 80 to 90% within a month and a half. So it was definitely an intervention that was developed out of need, but nonetheless, it was very effective. And then one other thing, we did have a parent meeting as well. I'm sorry. To give the parents a heads up on the purpose of this club, that it wasn't just a school club to have fun, that their students, that we had recognized that their students were high need, that we wanted to monitor them and support them, and we wanted the parents to encourage them to be positive leaders in this club, so that we were all on the same page. That was critical, because obviously the parents were aware of some of their children's needs as well. Sorry about that. Thank you.
No worries. Actually, I was just going to make a point of saying, in regards to parents as well, this is also as a follow-up to and to enhance kind of what was already provided here. Parent groups or parent resources that were provided to these students and to other students who have had an attempt or who have been hospitalized, providing really intentional groups for parents to be able to discuss things that aren't normally brought up in a mental health presentation or suicide presentation, including what happens post-hospitalization. How many of your parents actually know or remember to, and I hope that they do, and if you have them, wonderful, but even locking up medications or how to essentially make that transition from hospital to home. So that might be a specific topic to enhance what's happening here in this club or intervention. And that's what helped some of our parents. And we'll talk a little bit more about it. You might even see a picture of some of our parents too.
All of you can read the slides because we outlined essentially our steps in rolling this out and what type of curriculum we covered with the students and what kind of activities. And I see we have a question about ages. So for the ages, for the true mental health intervention, I would say junior high and high school is where it was most effective. If you did this with elementary, it would just be a little less intensive, but it would be more appropriate for the age. But of course, it's effective at all ages.
Yeah, there was another question in the chat as well, and this is something that I was kind of thinking about. So what about your students that, especially right now with distance learning or stay-at-home orders have been extended, or at least for California, what about the students that have been hospitalized or have high-risk behaviors and they still haven't connected to resources, either for a variety of different reasons? Maybe like right now I know in California where there's a couple of different counties that are having a little difficulty in having like long wait lists and different things like that. So how did you address some of those issues in regards to students that have not been connected to resources for whatever reason it is? Was this something that was part of that conversation?
This was really more of an on-the-ground intervention. It really hasn't taken off on virtual learning. But for those students that you're talking about, for the most part, they've been identified through their student consultation teams, or we call them COS teams at schools, coordination of student teams. And for those students that we knew were the highest risk, we've increased the communication with their parents, because essentially now with distance learning, the parents are on the front line 24/7. Where before it was often the case that the student would, let's say, hide some of their symptoms or not share or shut down at home and then come to school and talk to a school counselor or a school social worker. But now everything's happening at home, right? So those social workers have to speak with the parents and work with those students. And so we're just sharing the load, if you will, as far as case managing those highest risk students. All right.
We'll continue with some of the tiered activities. This just talks a little bit more about Tier 2 targeted early intervention. You'll see a lot of small groups that are provided, again, telehealth versus in person. What I want to say is this, and I think that for our team, we really had to make sure that we gave ourselves a little grace in the sense that a distance learning group may look like a group of students on the screen and the screen's completely blacked out except for their names. And yet they are present, and yet they are participating, because that chat, I've learned to really become accustomed to and appreciate the chat, because that's where participation does happen if they're not comfortable enough to talk on Zoom or Google Meet or whatever that happens to be. So please know that participation looks a little bit different, but these groups are still possible. And it may be something that is mental health specific, or it might be more social emotional or even restorative practice. The point is, though, that suicide prevention doesn't belong solely for those providing mental health services, right? When we're talking about it in other ways and providing education in other ways through our other team members. So that's just one thing I want to say about this. On the next tier, I just want to make a point of saying Tier 1, which is more universal. Correction, please forgive us for the title should be aligning activities by tiers, Tier 1. But you'll see on the left side, Tier 1, universal, we're talking about prevention. You're going to see the bulk of our campaign activities kind of live in this area. But how important is this area? Because I think what we're talking about here is not only mental health awareness, but it's reducing that stigma so that we can then incorporate or bring in topics like post-hospitalization support for parents or peer-to-peer support for those who need it the most, is if we can actually begin with, again, reducing the stigma and opening it up. So I'll focus a lot on the Tier 1 activities, but it could be, let's stay on the distance learning side here in this first column, right, of mental health helpline coverage, especially now. I ask folks to consider, because even though you have structures, and you go back to your school sites and you have folks that are assigned to different sites. What we were seeing during the pandemic is really, even with that, this is still a time for crisis. This is still a time for chaos. And so we may think that a handout has gone out to our students, families, and staff, and yet they don't know where to go to. And to have one singular line that's staffed by a live person through the school district, ours are staffed by the school social workers, to answer those mental health crisis questions, or to be available to provide those resources on hand, that has absolutely opened the door to be able to reach students and families who would not normally be referred. And let me restate that again. This line has been able to reach students who were under the radar, who had not been referred in the past. These are new referrals. And so in the first month, this line really validated its own need. Going further, we talk about drop-in groups. That now our services, as part of this campaign too, is to provide psychoeducation. And drop-in means opening it up to folks who just want to come in and putting those Zoom links out there. And the content is in and around mental health support. So provide that out there. Again, it's an information push out and education out there. Helps it to make it okay to ask for help. Other things, presentations, guest speaking, open hours. We had a lot of team members just provide open hours for folks to Zoom in or to call in. When this is consistently done week to week, they know where to find that person. It absolutely is an opportunity, one, to gauge and see how folks are doing. And we had individuals or students return and repeat each week just because they want to connect. Sometimes with informal supports are some of the best and allow for the greatest connection. So please don't undervalue that. Other things, professional development. You know, even offering voluntary opportunities to learn more about mental health, or even what the process or protocol is for suicide. I know the challenges of, you know, trying to work it within the school day, or mandating, what does that mean these days? And also there's issues with hours and union things and all of that stuff. What we found is in even offering voluntary workshops or professional development around mental health and suicide prevention, or whether that be synchronous or asynchronous, they were used because our teachers, our staff members, they wanted more ways to be able to help students. And it goes on to talk about crisis response, and we'll get into that too in session 3. And then there's all the activities. Suicide Prevention Day, Resource Fair activities, art contest, all of that falls and is still possible in distance learning. We just have to get really creative with that. And again, we'll go back to that. Resource linkage continues, as well as telehealth-based handouts and materials. Just making sure that that information is available on your website is going to be critical, and in one singular location. And it's just interesting because everybody has resources everywhere. Where we saw an uptick in folks visiting and getting what they need is when all of our different departments put all of the housing, basic need and food, mental health, parent resources all in one place, making it as easy as possible for our parents. In person, similar things, working with your extended learning folks or your after-school programs is going to be critical. What else have we done? Again, we did do the presentations. One of the ones I want to highlight is it's not always just the mental health professionals. Sometimes it's our parents, consumers, the folks receiving the services, who they themselves get trained in maybe NAMI interventions and provide it as a education piece to other parents. So again, the only difference is that we are in person. So last, the only other one that's not on there is school newsletters and resources, and that's just a complete out of information to make sure that even though you've told folks once, even though they've received it at the beginning of the year, to continue and make it a part of the culture, again, which leads to reducing that stigma of using the resource, but continually making sure that they have that. They have those resources and numbers.
One thing I like to talk about as far as the helpline is that helpline needs to be a cell phone, not a landline. Because no matter what in a district, even if you give out a direct number, somehow or the other it gets bounced around to other people. And what is important about that line is that it has direct access and that the community believes that it has direct access, that they're not going to get bounced around and that someone's going to know that they're calling in for help. And because as a tool, a cell phone can easily be forwarded, as staff rotated shifts, we would just forward the phone number to their cell phones. So logistically, it was much easier than asking someone to sit at a desk at a certain time, especially when we're in COVID and we're being safe and folks are working at home. So having a cell phone is truly effective as a tool versus, our traditional landline phones.
Yeah, the other glitch too, when at a previous school district that I was working for, the support line was a landline, and so I would check the messages every so often. But it was really difficult to get a hold back of the parents again, and then they would have to call back and leave another message. So I think Heidi makes a really great point that it has to be a support line, and of course it has to be monitored. And make sure that if it's after hours, that you kind of leave a message and all those pieces. But a direct connection is really important too. And the other thing too is like whenever a family, there's a window of opportunity whenever a family has a crisis, and if that window of opportunity is tiny, and then once they're not reaching anyone, it closes, and then they're not. It's so hard to get them engaged again. And I know there's a lot of questions about engagement in the chat, and then also how do we get these support groups going when students are not really engaged right now. So we'll talk a little bit more about that as far as like resources.
So just a few more highlights. We're going to go quickly through this slide because we want to get to some of our other materials, but just ensuring that your board policy, your guidelines, and all of those are again updated. And so even if you started with year one and you created a foundational policy, there's probably legislation. I know for us there has been every year to update that policy. And I know that's more work, but it's also an opportunity because each time you update a policy, it becomes very visible. It becomes discussed through the board meetings. If your board meetings are televised, then the community is seeing that. And so it's a great way to, again, keep the momentum and keep the discussion alive. We want folks to know that this is not a program per se, that in 3 months we rolled out a couple of fun activities for suicide prevention and we're done. This is a message that must be ongoing and completely integrated and fully supported throughout our school year.
Yeah, this is a great, another great point to get the buy-in from all of the stakeholders as well, because a lot of times we have different initiatives that come through. And so they're thinking, oh, it's just another initiative, but updating this information and including everybody in the process really creates that, enhances that buy-in for all the stakeholders as well. It's really important to do that.
So just wanted to give you an idea. I know it's kind of hard to see, but I'm going to read off some of the items here. But what I want you to see is that there are protocol or what is a flow chart for suicidal ideation and support. What I also hope you see is a little bit of the branding as well as even the color choices. And it doesn't seem like it might be the most important thing in the world, but the branding piece absolutely does link back to the campaign, and that's intentional. Just really quick, as far as protocol goes, you'll see we explain what happens when school personnel observe or are reported that there's warning signs for suicide ideation. A walk or talk referral essentially means that when in person, we're going to make sure we're not going to leave this student unattended, that we're going to either walk with them to get more support, or we're going to talk with them, if we're the appropriate person to talk with them, about what their thoughts are, what their plan is, etc. We did have to spell out no electronic communication. It's that much easier, right, to just email these days or to text. We need to hear and serve that student most immediately, so that's why we put that on there. It talks a little bit more about, in that second box, about what you're doing, physically walking or verbally talking to the student and naming people. I think that's critical. And that it's not just one discipline or not just one person or group, but it lists from school psychologist, social worker, school counselor, school nurse, or if you have an SRO, an SRO. And then not making folks work harder, putting the numbers on there, whether it be your support services office, school climate office, or school psychologist team putting it on there. And there's a couple of different routes it could go. So we did the split too of when it is low risk and we're talking about monitoring and supporting. You see there the list as far as notifying and ensuring that a plan is in place. On the other side of that, intensive assessment needed, and that means calling school police or local police, depending on where you're at. Your county crisis assessment team. My hope is that all folks on the line do have that. Or it could mean assisting that parent in getting to the emergency department for assessment. Further, it goes on, we actually put this in, and this is what we, again, will explore more in session 3, but re-entry meeting and what are its components. After a student has actually been hospitalized, so they're following that right side of the flow chart. They have been assessed, hospitalized, and then discharged. How do we support them in their accommodation back? And breaking down what a re-entry plan is. So that's essentially the flow. And this has been for more of the assessors as well as for our administrators to know. And I say that purposely because in the next couple iterations of this, you'll see how this flow chart has changed. The message is still the same, get help now, and there's things to do, but it changes. My hope is that folks are moving into this direction, that if you are in distance learning, wherever you are, or even in a hybrid case, that there are modifications made. This is a change that actually incorporated the flow chart or protocol according to distance learning. We have to put on there immediate referral. Again, no electronic communication because we have, again, become comfortable in electronically talking to each other or saying, oh, this is what's happening. And now that folks are working at all hours of the day, if we don't address things immediately, they get put off until the 8 p.m., 9 p.m. hour, and how much time is off, and hopefully no harm has been done. The other thing I want to say about that, about electronic communication, is the fact that even though we are working remotely, that checking isn't necessarily happening. And folks had actually, a trend that was happening was something was said in the Google Meet room or earlier in the day, but it actually wasn't reported until instruction was done. I caution you against that. Make sure we're letting teams know. Don't wait till instruction is done. Come up with a protocol when in the classroom, what you can do to support that individual student. If it's imminent, you'll see the 911 call. Again, you're going to have this as we email this out to you, and you'll see what happens when they are hospitalized if you follow that flow all the way down. On the right side, if it's non-immediate, non-imminent, what does that mean, and who do you call? And I will urge you to put on multiple or have that plan of 1, 2, 3. If you have 4 or 5, do that too, because it is very different to be able to communicate and reach out to folks as we work remotely. So know that. You'll see the additional mental health helpline on there as well. Aside from that, it talks about if not hospitalized and if hospitalized. And the last point I'll make is we're still doing mental health reentries, even though we are in distance learning. And that has to be said and put out there for teams. Still a tool for assessors as well as administrators. And the next tool, the next slide, is one that simplifies the process a little bit more. One of the things that we know is that the other two protocols were a little bit overwhelming. And for teachers and support staff, there was a need to simplify the message. One, even in remote learning, when we think that they know that there's a system, a protocol, a process, we have to make sure we confirm it and we say it. So make sure that that is reiterated or said again. And secondly, simply saying there is a protocol, there are people to call, we're still doing walk or talk, and for more information, we can help you call. You can also call us at the department. That's critical. I don't know if you want to add anything else on that, Heidi.
Yeah, I think this is a great example of being flexible and responsive to your staff. we realized after the second year that the responder, the first protocol, was overwhelming the teachers. They didn't understand it. It was too much to remember. And of course, they're balancing classrooms and doing a million things on their own as well. So it's just a great example of, it's not about creating a protocol and now we're done and everyone should do the right thing and it's over. Realistically speaking, it's about flexibility and being responsive and supportive when you see that there are unique needs of different groups in your district who may need specialized training or a specialized protocol. Anything and everything that's needed is critical because, again, this is about saving lives.
So as we move forward, we're going
to like this too.
Yeah, great. As we move forward, we're going to talk more activities. You never know what's going to resonate with folks, right? And so I talked earlier about an art contest, and this is one that even the little ones from second grade and up, we invited all grades, but second grade and up have an opportunity to be a part of the helping message. And I just want to quickly read to you a message from one of our high school contributors who was a part of and won an award for her art submission. It said, "Dear We Care team, thank you so much for finding the beauty and message in my art. I am beyond grateful that you chose my piece above all others. Beyond the prize money and award, this contest was very special to me. The opportunity was greater than I could imagine, and I am forever changed by it. Thank you for all the love and support that you all provide for those who are struggling. You are saving lives and showing that help is possible if you just embrace it. Thank you again and all the love." So again, you never know what's going to resonate with people. And when we're talking about universal and reaching all students, promoting the message, reducing stigma, think about those simple things we do on a daily basis, like art, that can be turned into something larger. Another shout out I want to put out there is that working with a department you wouldn't necessarily work with on a daily basis, like our visual arts and performing arts department, helped to increase this so that we had folks providing writing songs, students writing songs as well as performing and providing monologues to support this. So get creative, have fun with it. Again, it all helps in the name of saving lives. So the next one.
Yeah, and like you said, it's fun and creative, and it's also a form of expression and helps students with the anxieties that they were feeling, and then they see their peers participating, so all of that works in the favor of prevention.
So this is a fun one, and Heidi touched a little bit on funding as well, and she'll share a little bit more too, but again, branding is critical. So working with your local printers, I was just going to say that we have shirts, even the face mask that was made and is used currently. You'll see the student shirt, the adult shirt, and so it started out with, hey, let's wear it one day a week, to folks are wearing it every week on different days, and of course on our We Care Day. Do you want to share about the initiative?
Definitely. Budgets are always a concern, but I definitely can say that when you find the right partners, it always helps quite a bit. So we found a vendor who was just getting started, and they created a link, and so we just sent the link to the world, and staff were able to click on this link, purchase a shirt at fairly low cost, and of course everyone had to buy it on their own. And then there was a $2 fee added, and that $2 fee was kept on the side for the white t-shirts that you see in some of the pictures. And those were shirts that would then be donated to students and parents who volunteered in the capacity of supporting the campaign. And that way we were able to share shirts across the board. And of course we kept the cost of the fashion items, if you will, at a very low rate. Even if you had a few $1,000s to buy t-shirts for folks, you would never have enough, because then you have your teachers, your principals, on and on. Everyone would want one, and then when you leave people out, then people feel potentially offended or excluded. So it's much better to just put the link out there, encourage people to buy. And what we would also do is, for example, once a year we had our leadership meeting where all of our district managers came together. And we set a table up outside with all kinds of sizes and types of shirts, and they could just buy it right there on the spot in cash, and then we gave that back to the vendor. So that took care of the fashion. Otherwise, we also let schools use some of their school-based funds when they would do lunchtime activities. So it's not something that the task force per se always has to fund. If you have a mental health team budget, sometimes you can get money allocated there. One year, one of our departments had excess printing funds left over, and so we utilized those printing funds to get some of the artwork that Tina highlighted printed into posters, and we were able to share that throughout the community. One more last plug I'll put in for the video is that in this day and age, most school districts and most high schools have, and even junior highs, a digital club or a digital media program. And so once this district video was created, it kind of created a little fever, and a lot of the schools started to make their own videos. And so it might be something, instead of creating one for the district, if you don't have a budget, is put out a contest and say who can create the best one out of all of our schools. And then you have 5 or 6 videos, again, created by the students for the students. It's another way of keeping the budget low.
One of the last things, I was going to say that one of the, in Orange County at least, that there were several organizations that received CARES Act funding to create youth engagement activities. And so I completely understand that schools are very overwhelmed right now with trying to engage students in distance learning. But this is such a great opportunity to be able to partner up with the providers who have access to this funding that's free. We just finished rolling out a video challenge where students were able to create their own professional video in messages of hope and strength. And these are some of the pieces that actually can be connected to any of the messaging on the website, newsletters, different things of that nature. So it's really a nice opportunity. If there are some community members or providers that have received this funding, this is a great way to really connect some of that as well.
Yeah, one memory I just want to quickly share is that at one of our leadership meetings, so leadership for the entire district, everyone from principals to coordinators, directors, et cetera, and board and cabinet attended. And we essentially just set up shop outside, right, to sell shirts. And one of the wonderful things that happened is I don't think there was an administrator that left the leadership meeting without having purchased out of their own money their own shirt to promote the message. And of course, all the proceeds went to student shirts, right? Those who were part of mental health awareness clubs, GSA clubs, et cetera. So it was just really amazing, and what a message that leadership sent out by ensuring that they had these shirts. And from there, it's grown, right? They want to turn it into passion. They want to put it on some of their own department shirts. So it's really more of an energy that's created and a movement that's happening.
It's great that you mentioned department shirts, because that's another low budget option, because after school staff, the nutrition staff, sometimes health staff, all of them already have uniforms that they're mandated to wear that are already provided and budgeted for in their own departments. And then what you do is you just give everyone open access to your logos and your themes, your materials, so that they just add those to their uniforms. So perhaps it's on the sleeve or on the front or on the back, but either way, you have this whole We Care message that kids are bumping into everywhere they go on their school campus. This is just an example. Once we had all agreed on our original logo, which was a distressed heart, then we also developed newer logos, and many students were requesting these. We have the butterfly, which is for dreamers. When this campaign started, there was a lot of issues with immigration that had just kind of come up, and in our community, that was a very large stressor, and so we wanted to send a message to dreamers that they were supported in our district. And then we had the idea that we needed to target our most vulnerable groups, which would include our LGBTQIA as well as including our transgender students. And the students, when they order their white T-shirts, they get to request which heart they would like on their T-shirt. And so it's really exciting that which hearts they choose, because they like to present themselves as allies to each other as well as representing groups that they feel affinity to. But either way, everyone knows that the We Care Heart is about one which is all of us caring for each other. And then you can see here,
You are seeing,
Tina had mentioned the templates. So you can see the slide on the left, kind of that red background that was used for all of our signs, etc. Tina?
and that same one, I just want to share that one thing we haven't talked about is some of those Zoom campaign or virtual and distance learning campaign pieces. You're also looking at the bottom left corner where the backgrounds that was sent out to all staff throughout the district. When you're Zooming, why not have the We Care background behind you, right? So making those modifications and again being really creative about it is critical here. So next slide. We talked a little bit about parents and including them in this campaign and making sure that our materials work for them too. And so what you see on the bottom left, the green there, is a self-care calendar with every day mapped out in the month of May, right, of ideas or ways that they can take care of themselves. I know you can't zoom in per se. It's really kind of small, but this was the beginning or towards the beginning or mid-beginning, I guess, of actually being shut down or schools being closed down and doing distance learning. And so that was really tough for parents, and it continues to be tough for parents. So what are ideas that they can do on their own for their own self-care? And, of course, providing it in languages that reflects your community is important. In the middle is a picture of parents who actually attended some of those workshops we talked about, specific to post-hospitalization and learning about how to help their child, how to support their child, and how to acclimate after the hospitalization. And then to the right, mental health and wellness resource fairs. And I'll say this, it isn't, clearly it's not us that's putting all of this together, but there's a village of folks that includes all of the stakeholders we said in the past. But I'll tell you that we've had mental health and wellness resource fairs actually been developed by our mental health awareness club. So students actually pushing for, reaching out to our community partners to come to their school and provide resources to their students during breaks, during lunch, as well as parents and family provided resource fairs in the evening, right, that follow up to a presentation or a workshop. So a lot of, again, more creativity. But what is great about this is, we might add to the energy, but it's really others who are running with it. So I give them much, much credit.
And I know these self-care calendars were just as important when we went into distance learning as well. Folks were still asking for them.
Whoa, we're going to take a minute to pause. We have so much information that was provided to you right now. And so as we're thinking about all of the information that has just been presented, lots of really great activities, think about what activities or opportunities can you take back to your district to support trauma-informed suicide prevention. You can write your responses in your implementation planning tool, or you can put it in the chat box. And then also in the IPT tool or implementation planning tool, write at least one action plan or action item that you're going to take back to your school district and have a conversation about how to enhance some of these activities, all the information that was provided to you as well. We'll take a minute. I think one of the other pieces that keeps coming up in the chat is how can we get information? How can we get all of these tools that you provided? And I just want to remind everybody that the PowerPoint is going to be emailed to you, so you're going to receive this information. You can customize it as resources are needed for your district as well. And keep it in mind that all of these different activities were youth were actually included in the conversation as you're implementing your suicide prevention policy. And we talked about that last week, where it's really important to include them as part of the conversation. I know at one of the other districts that I worked for, students, ASB students, Associated Student Body students, had specific representatives that were called mental health advisors or wellness advisors. And these students are specific students designated to create some of these wellness activities. So it's part of the inclusion of having them be part of the conversation as you're creating activities, as you're creating the policies and procedures, or renewing some of the procedures as well. So that's really important as well. Using social media and texting to all families about self-care ideas. That's such a wonderful opportunity, especially during this time right now. So that's another great aspect. Okay. So we're going to move forward. I know that there's so much information still left that we have to present to you. We're going to skip the break and talk a little bit about the planning form. This is different than implementation planning tool.
And really, you can create this form on your own, and you will receive this this PowerPoint. But essentially, it's easy to become overwhelmed by wanting to make sure we reach all our stakeholders, all of our audiences, and also bring in the right actors, the collaborative partners, our administrators, teaching staff, support staff, community partners. So what do you do? And what we wanted to really just put together is a little bit of a form that helps to organize. And so if you see kind of at the top there, collaborative partners, how do we engage our community partners to, for example, serve our students? And in addition to their direct services, right, but to be a part of the campaign, one example there might be suicide prevention resource distribution, right? That they are actually one of the ones who not only bring their own materials, but maybe, for example, in distance learning, they're the ones who help to deliver because our team, for example, isn't able to do home visits. And so a community partner who's willing to and has different regulations is able to bring or deliver those helpful resources to the home when it's been difficult, for example, to reach them over the phone or through telehealth. Another example is engaging, teaching staff. And how do we engage teaching staff to reach out to community members? And so if you look down and across, right, you'll see an example of that being weekly social media community member or supporter highlight. You know, social media keeps coming up in the chat box, and so this is one that highlights it. But one of the things that we did, especially during the month of May, and we encourage you again to run with this, is each week, not just a message of caring, but also an acknowledgement. The highlight was, we're going to highlight, for example, the family and community liaison who has gone above and beyond to reach a family. Maybe they were able to find housing or basic needs, maybe even get them transportation to their therapy appointment, whatever that happens to be, but highlighting them on social media. Almost all of our sites have a social media platform. And so we don't have to be the ones who are followed all the time. We don't have to be the ones who are liked all the time. Sometimes, again, we just challenge others. We did weekly challenges of all the school sites, and it was great because it also caused some healthy competition between schools to see who could put out more of the message or could be most creative with it. So again, it's not all on us. There are ways to engage them, and again, this is just a tool to include all of stakeholders and collaborative partners. Other than that, what else do I want to share? One that sticks out, how do we engage community partners to reach out to community members to support? And that's an unusual one. If you kind of follow community partners down and across as community members. We actually had wonderful community partners who wanted to show what the district was doing and wanted to show their support. They themselves purchasing the face mask, they themselves wearing the swag and explaining and talking about it. And so again, caused more energy, and also it didn't live within just our district, right? And if it spills over into other districts and it continues, that's exactly what we want. We want the reach to get to students. And again, it's not about just our district, it's about all students getting help they need. So thank you for that. So we hope that this helps in organizing, I guess, thoughts. I know I need that a lot of the times too. In addition to this, just trainings, we wanted to just kind of highlight what are important trainings to provide for particular audiences. And it does look a little bit different. it's not just suicide prevention or suicide risk assessment, but for example, for administrators, what is their role and how do we engage other support staff in their roles? Because a lot of what they're doing is convening, organizing, making sure that the assessments happen, that the re-entry happens, and that the right support team is convened and put together. So that would be a training for them. Trainings don't have to be 3 hours long. For administrator, it might be a quick and a fast one that just, again, goes over the protocol, and that can be done in 15, 20 minutes. The point is that it just needs to be done. For teachers and staff across the way there, warning signs, what to look out for, how they can be ears and eyes of help and to report suicide. And for support staff, we don't want to forget extended learning, after-school program, other certificated, classified staff and partners. We got great feedback in reaching out and providing what our protocols are to the partners who have an MOU with us, who are contracted, who we refer to. They wanted to know what are the backup systems, what are the systems we have in the school district that support. And that kind of communication has helped to create this continuum of care from the school to the community, just because they know what's in place and they know who is a part of it. They know our roles. So that has led to streamline our services and communication. For parents, of course, warning signs and getting help, post-hospitalization support has been huge. For our mental health practitioners, it has been, of course, getting trained ongoing and bringing in community partners for that. And students, yes, we are doing student training so that they know where to call, where to walk to, how to get help. So thank you.
So this is an example of some of the things that to share during trainings. This is just a get help recommendation, helping people understand what you can do, reach out, ask questions, listen, don't be judgmental. You know, one of the things we would tell the teachers is don't say, oh, if you think life is higher at 13, it'll be so much better. I mean, it's so much better than when you're an adult with so much more responsibility. We don't want them to make those type of judgmental type of comments. And so this is just an example of something that was very simple. And again, for all of you mental health folks, all of this is 101 for you. It's not 101. It's not basic for education. This whole new world has been put in the lap of education. And so we as facilitators of this topic need to do everything we can to help them feel much more comfortable with it. This is just an example of a tool. Also, for each of us, our communities have special events, cultural activities, cultural norms and values. And so we want to reach out and connect to those activities and those special events and make our campaigns culturally connected, culturally competent. So this is an example you see in the bottom corner of the folks putting together this large tissue puffy poster together, and it was going on a Day of the Dead altar for Noche de Altares, which is a Night of Altars, which is one of the biggest events in our local city, and our city is the largest in our county. So you can imagine thousands and thousands and thousands of people go. And so since it is about recognizing and honoring those who have passed, it made sense to bring our campaign into that. So it was a great cultural connection, and parents came by, students came by, and they were so touched that we were a part of this event. And so just take a step back and think about what's happening in your community and how you can connect to those events as well. Again, sending that message to the community. We know that LGBTQIA students are, again, some of our most at risk. And what we noticed is an increase in our Gay Straight Alliance clubs, or some of them were called Rainbow Warriors, lots of different names. But as they were growing, many of their members were also coming to the We Care clubs, which were just the traditional outreach clubs for not the We Care Intervention Club. And so when the We Care Club or the GSA would plan an event at lunch, the other club would also want to plan an event, and pretty soon lunchtime was full of 4 or 5 activities, and the students would see that their peers were involved with both groups. And it just, again, it was a positive peer pressure kind of situation where folks were putting out kindness and positive messages and sharing. And so you can see that these students were all student leaders and their advisor behind them, she has on the polo, and they have on those white shirts and they all have different hearts that they had selected. So the idea is to create safe zones so you can communicate when you have anxiety or depression and you need someone to help you with suicide, or if you're struggling with other issues of sexuality. And then next week we're going to talk a little bit more about what we call our identity support plan, which is more of a tier 3 level intervention for this group. But again, when you're talking about suicide prevention, it's important to figure how do we target and support our vulnerable groups even more. Last but not least, as far as strategizing, we want to remember that this is not all on the responsibility of the task force or the person in charge of the task force. Once the foundational pieces have been accomplished, like the policy, basic protocols, training, then it's time for the sites to start rolling out their version, taking on the aspects of the campaign that they feel comfortable with, that fit their student population, or that their students are excited about. In this case, we had one of our largest high schools, one of our most popular schools. The cheerleaders came out at lunch and they created their own We Care Get Help t-shirt. You can see all the administrators were in We Care gear. And Tina worked with the community, and so did some of our social workers featured here in the middle, to get at least 10, 15 different vendors who were out at lunch with all these different tables for things for the students and their families to get involved in around suicide prevention. This is just one example of what a site can do. They all don't have to do an awareness fair. Some of them can do their own art fair or a play or a digital contest. The idea, though, is that the school sites start owning this and they start maintaining the message, sustaining the message as well, and not just relying on the task force. That's usually about the end of year 2 to 3 is when they really significantly take this on, and you start to see great results, wonderful outcomes, and of course, students' involvement. Funny story, when we first heard that a board member called and said, hey, we want signs in the restroom that have the hotlines. I can assure you that for many of us, we weren't that excited. We didn't think that signs with hotlines in the restroom were one of the major components we needed for our campaign. But after we thought about it, we thought, hey, you know, all students sooner or later go to the restroom. It is a great place to put the message. And so we soon changed our mentality, and we were really excited about it. The other thing is that this special request came from a board member, and when you have board support, it always elevates your activities and moves things forward at an even quicker pace. So once we addressed the special request, we got funding to create these signs. They were done in Spanish and Vietnamese as well. They were put in the restrooms, and in addition to that, again, it was an opportunity to gain more support. So then we had board members who were very aware of this campaign and now supporting our activities. And that's where you have that open door where you can say, oh, we need some money for next year. This campaign has gotten larger. We need funding. And that's where you get that support rolled out to you. So again, you know, getting that increased support really helps and supports the task force across the district as well as site-wide. Tina?
Sorry, took me a moment to find that unmute. But what we wanted to share with you too is that part of the campaign was also creating these business card size resources. And they're small, but they are mighty. And I will share with you that these are the two sides to it. And so you can see what the intervention was. And essentially when we had team members provide this to students, it was both an activity as well as a reminder, right, of their own support systems as well as the resources out there. What you should see on the top part here is local as well as national resources for support, right? If they're thinking about it, 24/7, who can you call? That's made available. On the flip side of that, which is the bottom part of the card, we actually work through and have them write in what are things that they can do when they feel sad or stressed. right? Who can they talk to at school, as well as who can they talk to within their family and friend group, right? And so we just wanted to make sure that they have this around with them wherever, in their backpack, in their wallet, whatever it is, that they took a moment to answer those questions and be really kind of thoughtful as far as where the help is. It's gone through some updates throughout the time, including including our mental health helpline was in addition to that. But the point is just making sure that it, one, is distributed every year, and that it is that tool that is used every time. And what we saw was it wasn't just staff providing it to students. We had parents and parent groups requesting that they actually receive these cards themselves, and they presented it to other parents and let them know this is what the kids have, and this is how we can talk about it. So you never know what starts with one idea and how it just kind of moves, but we think that's exactly the direction we want to go. And so kudos to those parents for taking this on.
Yeah. And I think the other piece too is that, as you know, we have different mandates in California coming through. This also suffices the Senate Bill 972, which all identification cards have to have the suicide prevention hotlines on there. So that really covers that process as well. And then the other piece too is like you can actually customize these as well, and then use them for, somebody mentioned earlier, like putting them on the website, in your walk-in virtual rooms, or drop-in groups and different things like that. So you can text it to students. And then next week we'll talk a little bit more about using some of the different platforms available, which is My3 app, which is a suicide prevention safety plan it's a free app for students. So we'll talk more about that next week.
Yeah, and you can also see this is in the very beginning, and so we did not have a standardized logo, so our heart was a little lopsided and not so distressed. And so we keep it around as a souvenir, as a memento, but our new cards, of course, each year are similar yet refreshed so that the students want to see what's new and parents are interested in them, and of course we translate as well.
It's in the archives.
Lessons learned, right? That was a strategy. You mentioned earlier a strategy. Right. It was a strategy that turned into a tragedy because we did not have our standardized logo, and then finally we do.
So, that's a really great transition, Heidi. As we wrap up today's webinar, I know we have a few minutes left. We gave everyone a lot of information, a lot of resources that can be customizable. And so I have a question for you. As school leaders, what are some of your top 3 pieces that you have learned as you're implementing a suicide prevention policy in a school district?
Well, I think one thing I would say is go slow to go fast. I mean, I'm a person who gets really excited, and I want to run with everything, and I want to run it now, and I know we can do it. We can do it all in 1 year. We can do it all in 1 month. But if you want it to be meaningful, effective, and truly be something that impacts the community in a quality way, you have to take it slow, do it well, bring the community in, bring your students in, get the staff on board. All of that takes time. But for every step you take in the small steps, you're building a strong foundation that creates longevity. And that's what's really important. This isn't about something that's going to be around overnight. It's about longevity.
If I had to add, I would add in do, repeat, and refresh. So absolutely do it. Move forward through it, right? And implement the strategies that work for you all, and also provide those trainings and information. But if not twice a year, then each year repeat the trainings and make sure that administrators, staff, that they continue to receive the information. We think we're being repetitive, but I will say this, that with the amount of change and stress and even turnover, that the message can often be kind of put to the side. So just kind of repeat, and each year refresh new ideas, be ready and flexible This pandemic has taught us a lot, and so flexibility comes in doing what we did, but doing it now in distance learning. So staying open and flexible is going to be critical. So those are my kind of takeaways.
Yeah, I'm going to piggyback on what you said, Tina, I just kind of wrote down implement, repeat, and refresh, right? So those are some of the different things that you want to do. And I think part of the other piece that I always think about is that resist the resistance. As a school leader, I often found myself having to address some of the newer folks, I would say, and then the seasoned folks, and then having that constant conversation about that's not my job, that's not my responsibility. But I always kind of thought about and brought it back to the students. It's really our duty to support students, making sure, not just the students, but also our staff members, to really make sure that we're supporting them, we're providing the resources that they need to be able to thrive. And I think that's the pieces that I really stick to. It's like resist the resistance. Like you're going to, like Heidi said, keep on going and you're going to keep moving forward and, be evolved, being creative, being innovative as part of the conversation as well. So I always kind of just think about those pieces. And as we wrap up, Tina is going to take us
down
to the last 5 minutes of our webinar today.
We started with Renee, we're going to end with Renee. But we're going to rededicate this work and the message to the brave and brokenhearted who have taught us how to rise after we fall. Your courage is contagious. And so for every student who has been in a dark place and that has needed help, this is what drives us, right? I think one of the things that we hope that you see is the why we're doing it. And it's for them. And we want to make sure that, again, take what you need, take what resonates and what works with you, and build it in whatever school district you are in. But we are very grateful to have you here and to join us and allow us to tell our story. And again, we dedicate this to our students as well as we dedicate it to all of you. So thank you again.
We look forward to seeing you next week.
And thank you. And the last few slides, we just want to make sure that you continue to, use the implementation planning tool, look at your action steps and taking it back to your district to implement, enhance, use some of the materials that were provided today. And so making sure that you're going to take an action plan for next week. And so we're looking forward to seeing everyone next Monday.
Thank you so much.
Thank you.